Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and everything in between. I'm your host, Sybil Amuti, and I can't wait for you to hear all of the Great Girlfriend magic on today's show. So without further ado, grab something great to drink, grab your pen and your paper, and get ready for this week's episode. Enjoy! Happy Friday, Great Girlfriends. I am so excited about this episode of the podcast that has been brought to you in partnership with HealthyWomen with support from Merck. We've partnered with HealthyWomen to debunk the myths and confusion surrounding HPV and cervical cancer. In our episode today, we dive into the basics of HPV and cervical cancer, their interwoven connection, common myths, and the importance of vaccines and screening. But most importantly about what you're experiencing right now is this intimate connective tissue between two women who are both advocating in this space and serving as support and even friends to one another as they help to eradicate HPV for women. And I'm so excited because in our pre-call, I got sandwiched in an intimate great girlfriend conversation that really explored the depths of who they are as women and why they're here. So not only am I honored to share their bios with you, but this time with you, I just am really incredibly grateful to have met them. They've already brightened my day. So I know as you're listening, wherever you're going today, you're going to feel that wattage and that bright energy coming from both of them. So I've got with me today, Dr. Jennifer Young-Pierce, who was recruited to MCI from the Medical University of South Carolina, where she served as a GYN Oncology disease team leader at Hollings Cancer Center and associate professor in Obstetrics and Gynecology. With a degree in medicine from MUSC and degrees in engineering and public health from the University of Virginia, Charlottesville, she's incredibly smart, Dr. Pierce became the first female gynecologic oncologist in South Carolina in 2009. Wow. Dr. Pierce served on the National HPV Roundtable as well as on the cervical cancer and immunotherapy committees for the NRG, the cooperative clinical trials group of the NCI. She is the Division Director of Cancer Control and Prevention at USA Health, Mitchell Cancer Institute, and host of the Cancering Show podcast. Dr. Pierce treats patients suffering from gynecologic malignancies, including all medical and surgical aspects. Dr. Jennifer Young-Pierce. Wow. Welcome, Dr. Jennifer Young-Pierce, affectionately known as JYP.
Thank you so much. It's great to be here.
I'm so happy to have you. And next up, Tamika Felder, who is a beacon of hope and resilience for people navigating their own challenges around the world. Whether delivering a captivating talk or working as an award-winning TV producer, Tamika is all about driving change. Notably, as a cervical cancer survivor, she founded Survivor Inc. in 2005 to empower women to share their stories and take control of their well-being. She lends her sought-after voice to presidential panels, international conferences, and media outlets. And she's the author of Seriously, What Are You Waiting For? 13 Actions to Ignite Your Life and Achieve the Ultimate Comeback, as well as her own blog at tamikafelder.com. In intimate conversations, public stages, and the written word, Tamika's brilliance shines as she transforms her experiences into inspiration. Tamika Felder, welcome to the Great Girlfriend Show.
Thank you so much for having me. I'm honored to be here, especially with JYP. And now I'm honored to be here and know you.
I'm telling you, I feel like the two of you have been doing remarkable work. And it sounds like you have over a decade of experience together. So I just want to thank you both for being in this space, not just for yourselves, but also expanding your reach to change and transform so many, what I will call millions of lives through your message and your vision. So thank you both.
Thank you.
Well, we appreciate the opportunity to increase that reach. So thanks so much.
Yes. Okay. So I want to start with the basics because I know that there will be many listeners, perhaps like myself, who are unclear about what HPV is and its connection to cervical cancer. So JYP, I'd love if you could kick us off with just a clear explanation of HPV and its connection to cervical cancer.
Sure. So human papillomavirus, or HPV, is a very, very, very common virus. And there are over 100 types that can infect all different types of our body. But the ones that we are talking about is up to 40 types which can infect the genitalia, and in specifically 14 types that can cause cancer. And so when we test for HPV, we're only testing for those 14 types. But it is important to note that the low risk HPV also is a component of commonly genital warts or condyloma. But when we think about HPV and cervical cancer, we know a few things. First, that 80% of adults that are unvaccinated will catch HPV at some point in their life. And of those, about 1 in 5 men and 1 in 4 women are currently infected with a high-risk HPV. Okay. That equates up to 80 million adults. So it's incredibly common. I say it's about as common as the common cold. And so then, of all the people who get HPV, the vast majority will clear that high-risk infection long before it ever causes a cancer. But of the people in whom it persists, it can cause cancer. And for cervical cancer, about 99% of cervix cancer is caused in part by HPV.
Wow, such a high number.
Absolutely, yes.
Yeah. And
high numbers in the other HPV cancers that we think about, but not quite as high as the cervical cancer.
You know what's interesting? I mean, I'm today years old knowing that men could have HPV. I don't know why I did not know that it was common in men as well. I had no knowledge of that. I've heard about it in the female population, but I've never heard of it in the male population.
Yes, it is more common in the male population than in the female population. And this is also important to note. So HPV causes most head and neck cancer as well, particularly pharyngeal and tonsillar cancers. And that head and neck cancer in men has outnumbered cervical cancer in women in the United States since 2016 and is still on the rise because there is not a screening test. So we know there are actually more HPV-related cancers in men than in women. We're actively trying to prevent both.
Wow. This is big news. And so are there symptoms that we should be aware of, particularly as it pertains to cervical cancer? Jennifer and JYP, and I'd love, Tamika, both of you to share, because Tamika, I do know that you are a survivor and you probably have firsthand experience with those symptoms. So I'd love for either one of you to just jump in with symptoms that we should really be on the lookout for.
Yeah, I think JYP can definitely talk about the clinical symptoms. For me, now that I've been doing this patient advocacy work for so long, I know what the symptoms are. But I will tell you, when I was diagnosed, I did not. And so one of the things that I think it is common most with women who have cervical cancer, even though you can still have cervical cancer and not have the symptom, is bleeding during or between sexual activity, but also lower back pain, leg pain, heavy menstrual cramps, things that I think that if we have those symptoms, we pop an extra pain pill, get a heating pad. Sometimes we have to know what the symptoms are because our body whispers and we don't know what these things are. But, now I'm just like, anything that happens in your body, don't wait, get it checked. But JYP, definitely, talk about any signs that people should be looking for.
Yeah, well, I appreciate that you mentioned all of those, but I think really what I want to emphasize to people is early stage cervical cancer is asymptomatic. And in particular, pre-cancer, by definition, pre-cancer is asymptomatic. You won't know you have it. The only way to find out if you have it is to see a doctor and get screened. And so that's why that prevention message is so important, because when there is an opportunity to prevent it becoming cancer, it is asymptomatic. And so getting those, regular screenings is so important. Mm-hmm. The same is true for head and neck cancers. It presents often as a swelling in the neck or the throat, and people don't know they have it until it's advanced stage.
Wow.
So that's similar to what happened to me, because I went in after not having insurance for a while. I started a new job and I had a boil under my arm that had nothing to do with cancer, but it got me in to see the doctor. And so I went in thinking, the doctor's going to say, do this, lose weight. You're good with this, but focus on this. And when all was said and done, I came back 2 weeks later to a diagnosis of stage 2A cervical cancer and had to have a radical hysterectomy. I didn't lose my life, but I lost my fertility. And then I also had to have chemotherapy and radiation. And so prevention is the key to all of this. And we cannot say this about a lot of cancers that we know what the cause is. We have diagnostic tools to detect the virus that causes it, and we have a vaccine to completely prevent it.
So when you went in for the boil, what was the detection? What was the correlation in that appointment that led to them discovering cervical cancer?
So I went to an emergency outpatient, and literally the intake process, between the nurse and the doctor was like, when was your last screening for this and that? And I was like, oh, maybe 3-4 years ago. And they were like, well, you definitely need to be screened. I was like, well, this is a good time. I'm starting a new job. I have health insurance, which I didn't have for the previous job that I was on, which is very common in some jobs like, broadcast, where you have freelance jobs and you don't have health benefits.
Yeah.
And so literally, I went in not expecting this. I, in fact, thought all the doctors were wrong because I got multiple second opinions. Because I was like, I know what cancer looks like. I know I don't have cancer. I'm not sick. And in fact, I did have cancer. And so it really is, when JYP says asymptomatic, it really is true.
Wow. So then when you talk about screenings and that checklist, when we're in the doctors, at what appointments are we going to get that question about the screenings? And the last screening we've had, how frequent should we have these screenings, JYP? Give us something that I know our listeners are going to go, okay, I need to make sure that I can get ahead of anything. So what does that look like for patients?
Just to center on Tamika's story, I think, unfortunately, our healthcare system has changed in such a way that you probably won't get that question at an urgent care or an ER visit anymore, like you might have in the past. You might not even get it at a problem visit with an OBGYN, where they say, oh, you're just here for the boil on your arm. Let's look at the boil on your arm. And then, maybe you need to come back for your annual exam. So we do still focus on that word, annual exam. And I think what we need to say is every person should have an annual doctor's visit. If you haven't seen a doctor in a year for your routine health, see a doctor when you're not sick for your routine health. And at that visit, they should go through what cancer screenings you're due for, which ones you might qualify for. These days now, family history, not for cervical cancer necessarily, but in general, family history becomes huge, and you can start earlier with cancer screenings with a family history. So that's an important component of it. But for cervix cancer specifically, we want young women to start their screenings at 21. And that is usually with a Pap test, a traditional cervical cancer screening test. But at age 30, we want every woman to have a Pap test and an HPV test. So we are going to see in our lifetime, and there are certain organizations already recommending HPV testing as the primary method of cervical cancer screening. And it's going to switch in our lifetime because it's a better test. But right now, what is recommended by and paid for by our health institutions is co-testing. So having an HPV test and a Pap test. And a lot of doctors even are getting this wrong, that they think if you have a Pap test and it's negative, you don't need an HPV test. But that's the mistake. That HPV status of every woman is such an important component of what you were saying. How often do we show up and get screened? So if you knew that your Pap was normal now, but your HPV test was positive, then you would know, I'm not somebody who can go 5 years between screenings or 3 years between screenings. I have to get another next year. And if that one is also abnormal, I need more diagnostic or invasive testing. Whereas a woman who tests negative for HPV and has a negative Pap might safely be able to go 5 years, depending on her previous history and whether or not she's vaccinated.
Wow. This is really helpful information. And so when you start thinking about treatments for cervical cancer, I know, Tamika, you mentioned that you went through chemo, radiation, and you also had a hysterectomy. What are some of the treatments that are available? Are there any treatments available in advance of what you experience? Is there anything on a lighter side?
Absolutely. I don't know if I would call it lighter side. I think for the people who've had these procedures, they would say that they're traumatic in their own extent, but LEEP procedures, cryotherapy, different things to scrape the cervix, to remove those abnormal cells. And one of the things that I want to say to the listeners too, I know we're saying things that people may be fearful or thinking even, well, I won't get HPV or that won't happen to me. The truth is, and most every sexually active person at some point in their life, they're going to experience an HPV, right? And again, most time, as the doctor said, it clears on its own, but there are times like myself and those who've experienced it where it doesn't clear. And if you're going to get cervical cancer, you want to catch it as early as possible. You want to catch it, even earlier, so you won't need chemotherapy, radiation, or a surgery. You want to have the LEEP procedures. You want to have the cryotherapies. You want to hopefully get seen early enough where the cells kind of just go away on their own. But I want people to not be fearful of this. I think educating yourself and making sure that you have the correct information so that you're armed and you know what to do. One of my most helpful tips, and I wish that I would have listened to something like this, and I had it years ago to listen to give me that information, is be screened regularly by your doctor. Have, a rotation where you're going in and you're being seen once a year, as Jennifer said, when you are healthy, not when you're sick, when you are healthy. There's so many of us, I'm lumping myself in with it, who wait and go to the doctor when we're sick, when something is wrong. And yes, we're at a critical point in the healthcare in the United States where you're not going to be screened from the rooter to the tutor like that wonderful doctor that I had. She was just very like, I got you in here. It sounds like you're not seeing a doctor all the time, so I'm going to screen you for everything. And I'm lucky that she did, because I'm still here.
Yeah. Wow. So we've seen in the news that Black women are more likely to have late-stage diagnosis of the disease and more likely to die from cervical cancer than white women. I'd love for you, Dr. JYP, to explain some of the reasons for this. Could it be lack of access, generational mistreatment? Is it insurance? What have you seen or experienced as a practitioner?
All of that.
Yeah. I mean,
yes. And then
right.
some.
Right.
Okay.
We know there are disparities across the board, but I do want to say it's not in screening. There are disparities in insurance status and access, but thanks to federal programs that provide insurance across the board for poor women of every race, that many women get screened. And, here in Alabama, we have high rates of mortality, but our screening rates are consistent with the U.S. national average. And the reason I want to mention this is because where we see the fall off is in two things. One, disparities in women having access to follow-up. So being able to afford the important follow-up of an abnormal screen. I always say pap smears don't prevent cervical cancer from forming. The treatment of an abnormal pap smear is what prevents cervical cancer from forming. As Tamika was saying, a LEEP procedure or cone procedure, something that removes the abnormal cells. It's basically a lumpectomy of the cervix. And that's what prevents the cancer. And so we know that women who have an abnormal screen need to be tested further to see if they need this procedure. And if so, do they need it right now? Can they wait 6 months? Is it okay to follow them and see if it clears on its own? And those are all decisions made closely with the doctor, often well after the pap smear, when other tests have been done that are either more reassuring or more concerning. And so, it's so important to know your own HPV status, but two, so important to follow up those abnormal screens. But the other disparities do exist along the way that include making sure that every Black woman is offered the same treatment as white women and has access to it. I don't think we talk about enough the the stress of systemic racism in our society and the role that elevated cortisol and stress play in lowering our immune system, in particular, our response to viral immunity. And we are just starting to better understand that. But in each of those ways, I think it is important for Black women in the U.S. to understand that there is that elevated risk, and to fight hard through the barriers to make sure that you get screened, get follow-up, and know your status.
Mm-hmm. And so, Tamika, from your experience and even in advocacy, what are some of the stories that you hear?
Well, first, absolutely that the follow-up is a huge issue. So it's one thing to be diagnosed, but where's the follow-up care? Mm-hmm. And I remember when I was diagnosed, I didn't believe. I was like, the doctors got it wrong. I kept getting second opinions, and I was looking for that one doctor who would tell me, nope, all the other doctors got it wrong. You don't have it. You don't have to go through this. Of course, I never found it. But also, JYP hit it on the head. If we can't talk about slavery in this country, then we can't talk about all the ills that trickle down through not only just life itself, but especially in the healthcare system. Also, we're having this conversation, and we have to have a moment to talk about Henrietta Lacks, not just because she was a Black woman who was diagnosed with cervical cancer, but because she was a Black woman whose cells were taken from her. And without her cells being taken, we wouldn't have all these vaccines, but especially the HPV vaccine. So if we could just take a moment to honor not only Henrietta Lacks, but the Lacks family, her children, her grandchildren, her great-grandchildren, her great-great-great-grandchildren. Mm-hmm. And we have to do more of that. I feel a special connection to her because I was treated at Hopkins, and I have to tell you, I know the reason why I am at a place where I am now is because I had great healthcare. Mm-hmm. I had great healthcare. I had great follow-up. When I talk to other patients, they don't have great follow-up, great care. And that's not everyone. There are great clinicians out there. Dr. JYP is one of them. Mm-hmm. But the reality is not all physicians are created equal. Not all patients are created equal either.
That's right.
That's the truth of the thing. And I hate when people say, if you don't like your cancer center, if you don't like your doctor, just go get another one. It's not that easy for everyone. And we have to live in that reality. And so when we give people that advice, we have to think about that. But one of the things that I have vowed to do is to help close that health disparity gap. And it takes not just myself, not just Dr. JYP. It takes all of us. It takes having this conversation and talking about it. And that means we have to talk about uncomfortable things in order to close that gap. And so, are things getting better? Yes. Are they where we need them to be? No, because there are people in this country, the United States of America, who are dying of cervical cancer, and they shouldn't be, but they still are. So we have a lot more work to do.
Mm-hmm, mm-hmm. So when you think about, some of the stereotypes or stigmas tied to HPV and cervical cancer, I mean, because some of that could even be a reason why people,
absolutely,
don't want to follow up or feel, even not having comfort with a certain doctor, to have a safe space. What are some of the stigmas that you are very familiar with or have heard in your advocacy?
One of the things that I hate the most is when people say you got this because you slept around. The truth is you can sleep with 100 people, or you can sleep with one infected person and get HPV. That's the truth of the matter. And we have to stop shaming people, because the more that we shame people, the more that people die. Less people will get screened when we keep this stigmatizing conversation going. I've challenged healthcare systems. I've challenged partner organizations to stop with the language that says that this is a problem because you've had multiple sex partners. Well, most people in their lifetime will have more than one sexual partner. Mm-hmm. And if we keep this type of conversation going around HPV and cervical cancer, that we're going to get less people getting screened. We're going to get less parents wanting to vaccinate their children because they're going to think only a certain type of person gets this type of cancer. And so that's where we have to stop first. Also, on the flip side of it, it's people who think, well, you got cervical cancer, so it's an easy cancer. You just get some cells removed or you get a hysterectomy and you're on your way. And I think anyone who's had a hysterectomy will tell you firsthand that it's not easy, even with robotic surgeries and surgeries that make it, easier for you. It's not an easy cancer. No cancer is easy. And so I want people to know that we have the opportunity to eliminate a cancer. And one of the things that I know for a fact is that no one should suffer from cancer. Cancer is horrible. Cancer is not fun. Cancer is life-changing. And no one should suffer from it. So if we have the opportunity to wipe one of those cancers out, why aren't we doing it? Right? Let's do it. And in order to do it, we have to start making sure that people have great information. That means knowing that if you're looking up and getting all of your medical information from Google or Facebook, that's your number one problem. Facebook, social media is an amazing tool because anyone can be a publisher. It also is a dumpster fire because anyone can be a publisher. And so if your cousin's great grandmother posted something and you trust her and you love her, but that doesn't mean the information or the link that she's posting is a source link. Do your due diligence. And also, clinicians in the medical community have to understand that if we're dealing with certain cultures and communities, there is medical mistrust. And so there's heavy lifting and heavy work that needs to be done. And if you think we're far enough removed from slavery that we don't have to do that work, you're part of the problem.
So good. JYP, in your experience as a practitioner, what are some of the conversations or the whys when you hear people talk about, their experience with cervical cancer or their lack of follow-up? Are there any stigmas that kept them from connecting with you?
Well, I agree with Tamika on every point. First, you will notice I never said the word sex. And I can give an entire 1 hour talk about HPV and not talk about sex because every adult who is adulting is at risk for HPV. And that, there are undetermined transmissions with kissing. There are undetermined transmissions with genital to genital contact and hand to genital and mouth to genital contact. There's a million ways to get HPV, just like there are a million ways to adult with another adult. And, that shouldn't even be part of the conversation. Two, as Tamika said, we have to remove the thought that this is an easy one. Mm-hmm. One third of the women who are diagnosed with cervical cancer will die from it. 33%. It is horrible. Compare that to 5% of breast cancer patients pass away of their breast cancer. And the third one, the one that I think is just not enough in the conversation when we talk about the stigma of getting the vaccine and who's choosing to get it and who's not. People think that cervical cancer is not common because there are only 14,000 cases of cervical cancer in the country. But let me give you a couple of numbers. The first is 39,000 cases of HPV cancer of any kind, 39,000 cases in the country. And that outnumbers all the other illnesses from all of the other childhood preventable illnesses besides the flu combined. Wow. So it's more than all the measles, mumps, rubella, diphtheria, pertussis, all of them.
Wow.
And right. And then one other, we don't count cervical pre-cancer as cancer. It's stage 0 carcinoma in situ, the Latin term for cancer in place, meaning it hasn't invaded your body. Mm-hmm. In cervical cancer, we don't count it. We do not include it in the tumor registry. Our states can't give us those numbers, but we estimate there are 330,000 women every year who are treated for cervical precancer, at least prior to vaccination. Now, those numbers have gone down in the vaccinated population. Mm-hmm. But in breast cancer, that's 60,000 women treated for precancer, then another 230-ish thousand women treated for cancer of the breast. So cervical cancer, if you were to count all of the precancers, actually outnumbers breast cancer. It's just that nobody's talking about it. Nobody's saying I had a leap on Friday before the weekend and therefore, I'm not going out this weekend. Nobody's talking about, I just had my cancer prevented at the OBGYN's office with that cryo or conization procedure. We whisper about it in women's restrooms that, I had some abnormal cells removed. I had an abnormal pap. You tell your closest friends, but we're not shouting it from the rooftops. And so I think it's for people like Tamika and myself to say, this is common. If you know somebody who has breast cancer, and every one of us does, somebody or two people who have had a cervix precancer or cancer and had a procedure that saved their life, if they're still here with us.
Wow. Yeah.
I was wow the first time I heard that.
Yeah. I'm like, because I'm thinking of how little discussion there is, right? And even in my, in our circles, our friend circles and great girlfriends, as you're listening, you're probably going, we're not talking. This is one of the things that does not come up as often as it probably is visible to you in the medical industry, and it's even for you, Tamika, as an advocate, but it is something so relevant. And so it does raise flags for me in that, geez, we've got to get rid of the stigma that you should be ashamed or guilty or feel
that you're alone.
Yeah.
Right? I mean, you're not alone.
Exactly.
You look around the room, it's 1 in 6. 1 in 6 women. If any of you are sitting, listening to this, where there is a group of people, I want you to look around and think about how many heads in that room that means have had a procedure on their cervix, maybe just like you did.
Yeah. Wow.
And how,
that's why I started my organization.
Yeah.
Yeah, exactly.
Just that connection matters. It really does. And so I want to get into that just a bit, Tamika, because, the organizations, when you think about Survivor, I think it was 2005 that you established your organization. So that is a while back that you saw the need and you jumped in. And even in partnership with HealthyWomen, what have you seen in terms of impact around the stigma or even activating women to, follow up and get treatment early prevention, any of that?
Sure. Well, I created it for selfish reasons because I just was like, I can't be the only one. I can't. Yeah. And, this has been so healing for me. It gave me purpose beyond the cancer. But also, when I started this, it was just so we wouldn't be alone. We would have support. But then when I realized, wait a minute, are you telling me that unlike other cancers, there's things happening right now where we are shifting that needle? But where's the patient's voices, right? And so there weren't really patient voices, unlike breast cancer and colon cancer and lung cancer, and and so it really was, here are all these great people doing this great work, but they're sharing the data, but they're not telling the story. Mm-hmm. And so here are the patients who can tell the stories. And so that's how Survivor really works. It's one part support so that these patients and their family and loved ones know that they're not alone. But the other part of it is that, okay, wait a minute. We can activate ourselves. We can use our voices. We can support the data. We can show that it's not easy. We can show why it needs to be eliminated. We can show the realities. People can say it's easy because we're not sharing our stories. Right. And so I remember when I started the organization, I could barely get 5 people to share their story and show their face. Now it's hard for us to even keep up. We honestly, truly, we have uterine cancer survivors, ovarian cancer survivors, people with other disease sites who want to share and be a part of our community because we talk about the hard things too, but we talk about, yes, we had cancer. Yes, this is how our life is different. Yes, this is our new normal. But how do we live beyond those things? Mm-hmm. We accept what's happened, but how do we pivot to live with the ostomies, where maybe you've had your vagina or your anus removed because of your cancer. Maybe you will have neph tubes for however long. Mm-hmm. Maybe you're dealing with sexual dysfunction. How do you deal with those things and continue to move forward?
Mm-hmm. Mm-hmm. So speaking of moving forward, because I love the beautiful part of your story is when I got to see the face of your little baby boy. I know that cervical cancer can impact pregnancy, and in fact, it did for you. And JYP, mm-hmm. You've probably seen a number of cases. Tamika, your story of I don't know, I want to say it's sort of a redemption. It's just such a gift that you were blessed to be able to mother your 1-year-old in the way that you were blessed. And through your advocacy, this is returned to you in this way. And so I would love if you could talk a little bit about your personal issue regarding fertility and cervical cancer and what women should know going into treatment. And I just want to splash in that her little yummy baby boy is just as edible as can be. He's so beautiful. And I just am your story just really tripled my heartbeat.
So it literally makes me so emotional, and probably because he's turning 1 next week. But for me, Survivor became my baby. It is what I put my all into, and it's still my baby. But the reality is that, I was so depressed and so much pain when I lost my fertility. I wasn't trying to become a mom at that moment in time, but when it's taken away from you, the way that it was taken away from me, it is a pain that is undescribable, and one that you let hold you hostage for life, or you learn how to move forward with knowing that you will never be a mom, right? And so one of the survivors in the community, she said to me, she said, you getting this baby in this way, I feel is your story coming full circle. And when she said that, I felt it immediately, and I agreed with it, right? And so for me, having this chance, even so late in life at the age of 48 years young, I will tell you is beautiful. I will tell you that I didn't know that I had the capacity to love in the way that I love. I didn't know that I had the room, because my life was already filled, and having an almost 1-year-old is a lot of work. But when I tell you, this community, including Dr. JYP, they have loved me. They have supported me. Healthy Women, everybody is a part of this. It's why I share my son with our community at large. And I hope that our story gives other people hope that if you desire to be a parent, be open to the different pathways to becoming a parent. Because if I wasn't open to not having a child that's not biologically mine, or not open to getting an embryo for someone, DNA doesn't matter at all. This is my son. And, while I've been sitting here with you, his biological mom sent me a text message. I can already tell that it's a video of her twin boys, my little nephews.
Yeah.
And my life is forever blessed because I have all of them in my life.
Oh, that's
so cancer sucks. Cancer was awful. But this is the part of cancer being a gift that's wrapped in barbed wire.
A gift wrapped in barbed wire. So well spoken. Yes. Doctor, thank you so much for sharing that. It really, truly is. And it's a chapter inside of a big life. It is not the whole story of life, right? It's a chapter. And so, Dr. JYP, I want to thank you for the work that you do in helping women understand that one chapter doesn't have to determine the entire book. It's just a facet of a larger life story. And what you do is help to resurrect hope for all of your patients. So any ending call to action, just around the hope that you offer, or, screening or educating yourself, or believing in the possibility to live beyond the stigma that you'd like to share with our great girlfriends?
Yeah, well, for Tamika's message is just exactly kind of that whole thing coming full circle. I think for our cancer survivors that are listening, I think, first you heal physically, then you heal mentally, and then you find in your cancer story your purpose. And it doesn't have to be your whole life purpose. Many people go on to do the job they were already doing, but to find some meaning in the suffering. And I think that that's really valuable. Not that it in any way compares, but for me, the meaning in the suffering that we do as witnesses to our patient suffering, and as people who walk beside them. For me, I find that meaning in our work in prevention. And the message of hope is one that there is now a vaccine that prevents 90% of all HPV related disease. You know, the next generation does not have to suffer this and can choose to be vaccinated. And, you know, I vaccinated my girls at 10 and 9 years old because I wanted them to have the maximum benefit at the earliest possible time. And that opportunity exists for many people all the way into adulthood to receive vaccination, but also that I think, you know, I mean, there's a message of hope in the science too, that we're always trying to do better for the next generation. And, you know, the thing that struck me that still strikes awe in me is in the cohorts, the Nordic cohorts were the first to vaccinate and to have large population-based vaccination. And they expected to see, you know, 30% HPV cancers or 10% rate of HPV cancers compared to the vaccinated cohort, to the unvaccinated cohort. And in the vaccinated cohort, there were 0 HPV cancers.
Wow.
And they first saw it in Finland, and then they saw it in Sweden. There were 0. So is it possible that the vaccine actually works better than we ever hoped that it could?
We'd like to take a shot and see, right?
Yeah, exactly.
Absolutely.
Exactly.
Yes.
Worth taking the shot. Yeah.
Absolutely.
Wow. Okay. This has been wonderful. I feel like it's been one of the most endearing conversations I've had in a long time around something that is a very complex topic, but it's just because both of you are so intentional in your why. Your passion and purpose for the work that you do is very clear and evident. And I want to thank Healthy Women and Merck for bringing us together for this conversation, and for all of the great girlfriends that will take this and listen and share it with another great girlfriend, share it with the gentleman in your life, because the data shows that we're all impacted by it, right? And
absolutely,
consider this as a gift towards prevention and early detection. Where can everyone keep up with you, Dr. JYP? Are you on social media?
I am. I am on Instagram at J Young Pierce, and under the Cancering Show at www.cancering.com.
Okay, perfect. And what about you, Tamika Felder? Any place they can find you on social?
They can find me everywhere by Tamika Felder. They can find me and the organization under I Am Survivor on Twitter or what was formerly Twitter, now X, and Instagram. I Am Survivor, and just Survivor on Facebook. We're also on LinkedIn, and I am so happy to be here with you all and the listeners. Thank you so much.
We're so happy to have you both, and thank you so much for your time today. Great girlfriends, thank you for listening in. And I do again hope that you'll share this, listen to this episode, but also share it with your community as a gift and saying, I love you, let's get aware and let's make some new choices or activate ourselves in different ways for the sake of prevention and the sake of offering hope to someone else. All right, everyone have a great day. Enjoy. Thank you so much. Peace. All right, great girlfriends, did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast and the community. Speaking of community, make sure you join our Facebook group at The Great Girlfriends, follow us on Instagram at The Great Girlfriends, and on Twitter at @the_great GFS. I'm Sybil Amuti, and I'm out. Peace.